Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Why am I not losing weight on Mounjaro? It takes time, about 8 to 12 weeks, to see a 6% to 8% weight loss in adults using Mounjaro. Other reasons include you may need to follow a reduced calorie diet and exercise program, your dose may need to be increased, or side effects may affect your treatment. How much weight should I be losing with Mounjaro? In long-term studies over 40 to 52 weeks, when Mounjaro was used alone or with diabetes medications, weight loss in adults using the 5 mg, 10 mg and 15 mg dose injected subcutaneously, under the skin, once weekly ranged from 12 pounds, 5.5 kilograms, to 25 pounds, 11.4 kilograms. In general, higher doses lead to greater weight loss. In another study, after 8 to 12 weeks, people using Tirzepatide, the active ingredient in Mounjaro, at injection doses of 5 mg, 10 mg or 15 mg per week lost about 6% to 8% of their body weight on average. Mounjaro is not approved as a weight loss drug, but may be prescribed off-label by your doctor for this use. Off-label use means it may be prescribed by your doctor for a generally accepted use not specifically approved by the FDA or listed in package labeling. Tirzepatide, the active ingredient in Mounjaro, is approved for weight loss using the brand name product Zepbound. Both products are manufactured by Eli Lilly and Co. 6 reasons you are not losing weight with Mounjaro. Point 1. You have not given the medicine enough time to work. Studies have shown https://www.nejm.org/DOI/10.100056/NEJMoA22060382 that it can take 6 to 8 weeks to see up to an 8% weight loss with Tirzepatide. While most people will see at least a 5% weight loss with Mounjaro, not everyone will reach this goal. However, studies show that 89% of people using the 10 mg dose lost 5% or more of their weight at 72 weeks. On average, people lost 19.5% of their initial weight on the 10 mg dose after 72 weeks, 18 months. Point 2. Your dose may not be high enough yet. The recommended starting dose of Mounjaro is 2.5 mg subcutaneously once weekly, increasing to 5 mg once weekly after 4 weeks. The 2.5 mg dosage is used only for treatment initiation to help you get used to side effects. Doses are then increased as needed by 2.5 mg doses after at least 4 weeks on your current dose. As an example, if you require the maximum 15 mg weekly dose, it can take up to 24 weeks, 6 months, to reach this dose. Point 3. You may need to change to your diet or exercise routine. Mounjaro works best for weight loss when used with an appropriate diet and exercise routine. You may need to consume fewer calories, eat different foods that are lower in fat, and increase your amount of time for exercise on a daily basis. You can now follow the new 2024 guidelines published in Obesity that make recommendations on what to eat if you are using a weight loss medicine like Tirzepatide or semaglutide. Guidelines suggest that women taking a weight loss drug should eat between 1,200 to 1,500 calories per day and men should eat 1,500 to 1,800 calories each day. To learn more, see Guidelines for what to eat while taking a GLP-1-like weight loss drug. Talk to your healthcare provider or a dietitian if you need help sticking to your diet or exercise routine. Consider using a journal to track your daily food consumption. Point 4. Side effects may be interfering with your dose or treatment. Your doctor may further slow down how quickly you reach your target dose if you are having intolerable stomach side effects, which can be common with medicines like Mounjaro or Zepbound. In some cases, people have had to stop treatment due to these side effects. In studies, stomach side effects occurred in 37% to 44% of patients, 20% on placebo. Also, 3% of patients receiving the Tirzepatide 5 mg dose, 5.4% receiving the 10 mg dose, 6.6% receiving the 15 mg dose stopped treatment due to digestive tract side effects like nausea, vomiting, and diarrhea compared to 0.4% of patients receiving an inactive placebo treatment. Related questions: how do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? Tirzepatide versus semaglutide, how do they compare? Can you get Tirzepatide from a compounding pharmacy? 5. Other medicines you take may contribute to weight gain. People who have type 2 diabetes and are using Mounjaro for blood sugar control, weight loss or both may not lose as much weight if they are also using certain type 2 diabetes medicines. These medicines include insulin, sulfonylureas like glimepiride, amaryl, glipizide or gliburide, thiazolidinediones like pioglitazone, Octors, or osiglitazone, Avandia, meglinotides like netaglinide, Starlix, or ipaglinide, Prandin. These medicines can lead to weight gain of roughly 2.3 to 4.5 kilograms, 5 to 10 pounds, over the first year in patients with type 2 diabetes. Talk to your healthcare provider if you have other medical conditions and how this might interfere with your weight loss regimen. Point 6. You cannot afford it. This seems so obvious, but if you can't afford Mounjaro, you can't use it to lose weight. To find out if your insurance drug plan will pay for Mounjaro, contact them and ask if Mounjaro is on their formula. A list of the drugs approved for insurance coverage, which conditions it covers, and if covered, what your cost or copay may be. Unfortunately, your insurance company may not cover Mounjaro for treatment of weight loss, as it is only approved by the FDA to treat type 2 diabetes. But if that's the case, ask your doctor about using Zepbound for weight loss, another Tirzepatide product that is approved by the FDA for weight loss maintenance. Because it's approved specifically for weight loss, your drug plan may cover it. Learn more: is Mounjaro covered by insurance or Medicare? How do I get a $25 copay? In addition, there are copay card programs and patient assistance programs from Eli Lilly, the manufacturer of Mounjaro and Zepbound, that can help you gain access to your medicine more affordably, whether you have insurance or not. You may pay as little as $25 for up to a 3-month supply. Contact the Eli Lilly Mounjaro Patient Services Support Center at 1-844-805-5807 to learn more. If you have state or federal government-sponsored prescription insurance, for example, Medicare Part D, Medicaid, TRICARE of DoD, contact your plan to determine your eligibility for Mounjaro. Other options to Mounjaro. Other FDA-approved options similar to Mounjaro are available for use in weight loss. Wegovy, generic name, semaglutide, is a GLP-1 agonist that is FDA-approved for weight loss and is similar to Mounjaro and Zepbound, but works in a slightly different way. Semaglutide is also sold under the brand names Ozempic and Rybelsus for the treatment of type 2 diabetes, but these brands are not approved by the FDA for weight loss. How does Mounjaro work to cause weight loss? Mounjaro works by slowing how quickly food passes through your digestive tract, making you feel full longer. Feeling more full can help you reduce your food intake and adhere to diet changes, which can lead to weight loss. It also works by lowering lower blood sugar by helping the pancreas make more insulin and lowering the amount of sugar produced by your liver. This is beneficial for people with type 2 diabetes. In the body, Mounjaro activates two receptors, glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide 1, GLP-1, which are natural incretin hormones that help regulate blood sugar levels. This is not all the information you need to know about Mounjaro, Tirzepatide, for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.